Forward to all the things we're going to be able to do together now and in the future. My real pleasure today is to introduce the Dean of the Sue and Bill Gross School of Nursing, Mark Lazenby. Mark advocates for the profession of nursing as a pivotal force for social change, particularly in advancing health equity and promoting planetary justice. His beliefs closely align with our One Health vision for UCI Health Affairs, uniting health disciplines to advance the frontiers of discovery, educate the diverse future healthcare workforce, and provide whole-person, team-based precision care for all people. As an internationally recognized expert in psychosocial spiritual care within oncology, Dean Lazenby has pioneered empathetic, culturally sensitive approaches to cancer care. His work with prestigious journals and organizations, including the American Cancer Society and the NCI, underscore his commitment to improving support for cancer patients across diverse backgrounds. Prior to joining UC Irvine, he made impactful contributions at the University of Connecticut School of Nursing and the Yale School of Nursing, where he expanded faculty, advanced diversity, and implemented innovative teaching methods. Please join me in welcoming a true visionary, a compassionate leader, and a remarkable advocate for change, Dean Mark Lazenby.
Thank you, Vice Chancellor Goldstein. And let me also acknowledge several people here in the room without whose support this project would not be possible. Dr. Anne Marie Watkins, the Chief Nurse Executive of UCIMC. And I also want to mention Mr. Kartik Yadav right here, who was instrumental in putting all of this together. It is with immense gratitude and a deep sense of honor that I stand before you today on behalf of the Sue and Bill Gross School of Nursing to express our profound appreciation for CalOptima Health's generous funding of the school's Nurse OC program. This support is a pivotal investment in the health and well-being of our community. It will ensure that we address the critical shortage of nursing professionals in Orange County. The Nurse OC program is designed to significantly enhance the nursing workforce by providing comprehensive training and support to diverse nursing students and graduates. This program will enable final year registered nursing students, some of whom next year, these students here will be final year registered nursing students, and graduates from our family and psychiatric mental health nurse practitioner programs to receive rigorous didactic and clinical training in CalOptima's model of care called CalAIM. We are committed to training these nurses to deliver high-quality care to the most vulnerable populations in our county. CalOptima's funding of this program aligns with strategic priorities of the school. Our school fosters diversity, equity, and inclusion within the healthcare workforce by recruiting and training a diverse group of nursing professionals. We aim to reduce healthcare disparities and improve access to quality care for all members of our community. This program also supports the goal of increasing the affordability of nursing education, thereby alleviating the financial burdens that often deter talented individuals from pursuing or continuing their nursing education. Furthermore, the Nurse OC program underscores our commitment to community engagement. We are expanding our clinical training sites by collaborating with CalOptima Health across Orange County. This not only will enhance our students' practical training, but it will strengthen our region's healthcare infrastructure. The anticipated outcomes of this program are profound. The initiative will create a new generation of nurses trained in research, leadership, and the CalAIM model of care who are deeply committed and, according to the program, required to stay in Orange County for at least 2 years, thereby serving the needs of our diverse population. I extend our heartfelt thanks to CalOptima Health for your support and belief in our project. Together, we are building a brighter, healthier future for Orange County, one nurse at a time. Thank you. And now it's my privilege to introduce Supervisor Katrina Foley of the Orange County Board of Supervisors, the 5th District, who came to our school several months ago and said, do this, and make sure that your nurses stay in Orange County, and we've done it, Supervisor Foley.
Good morning, everyone. It's great to be here. I'm Katrina Foley, and yes, I'm your county supervisor representing the 5th District. What's a supervisor? Well, it's kind of like a county commissioner. I don't know why they call us a supervisor. And the outside, everyone always says, what do you supervise? But the district that I represent covers 650,000 people and growing, 14 communities from Costa Mesa all the way to San Clemente. It includes parts of Irvine, including UCI. And I just love being able to have this job because I get to serve and help people every day. And I love so many of you choosing the healthcare profession and being willing to step up and serve your communities. So everyone clap for our future healthcare nurse practitioners. But yes, thank you for including me today in today's presentation. These last 4 years has made it clear that nurse practitioners and our healthcare community serves as the backbone for our entire community and our healthcare system. And in anticipation of all of the healthcare worker shortages that we see coming forward, we've been trying to work creatively to find ways to incentivize more students coming out of high school, out of college, or maybe even individuals who are transitioning and wanting to go back to a different career to choose healthcare, to choose nursing in particular. And so we thank you for allowing us to share this creative idea. And yes, we did the tour, amazing place you have to learn here. And I know when the CalOptima team announced the Cal State Fullerton program, I literally, that's like moments later, was texting Michael Hunt, hey, what about UCI? And then we set up a tour here, and while we were in the briefing, we talked about how can we bring some of those CalOptima programs to support students to UCI, and here we are today. And for me, a big part of it is that we are supporting students not only just for their supplies, their tuition, but for housing, because we all know that housing is a critical challenge for people to live and work, especially for students here in Orange County. And we want you to stay. We need you. We want to train you up the Orange County way. We want to make sure that you stay here in Orange County. And we hope this investment in you will bring a return to the community. So again, $5 million from the CalOptima grant, and for students for a 2-year service of for CalOptima members, and that could be in our community clinics, in our county systems, at our wellness centers, working with mental health services, working with our permanent supportive housing programs through CalAIM. We have so many great opportunities for you. 60 RN externs will receive a $20,000 stipend. 4 family nurse practitioners and 2 psychiatric mental health nurse practitioners will receive a $30,000 stipend. These salaried externs positions will obviously help reduce debt. And as a lawyer and someone who's almost done paying my law school tuition debt, I feel your pain, and we're trying to help. Also, it'll help you to reduce, the burden on you so you can focus on studying. And then, of course, the housing costs. Maintaining our public health system here in Orange County, which we have a great one, and it's growing and it's becoming better and better. We are becoming a hub for healthcare here in Orange County, and we need you. We need to reduce our staffing shortages in this area, and we want you to share your experience with others and bring more nursing students into the fold here in Orange County. So I look forward to partnering with the nursing school however I can for the future, and obviously continuing to partner with CalOptima, who has been a great partner for District 5 and helping us to serve the more than 108,000 CalOptima members that are living in District 5. In the fabulous 5th District, where you have $10 million homes, you have people that are earning less than $20,000 a year, and they need our help. So thank you all for being here and for choosing health as your profession. Thank you. And with that, I'll invite Michael Hunn here, CEO for CalOptima, and who is leading the effort in trying to help us to train more nurses. Thank you, Michael.
So it's nice to be here. It's great to see the students. So just a little background. So I've spent most of my career in healthcare. So I started out as an intake director doing drug and alcohol treatment programs down in San Diego. And I had a lot more hair, and it was a lot darker than this. And I've always had a great love for healthcare. Then I moved into doing psychiatric care, and then I moved over to long-term acute care, ventilators, pulmonary, critical care. Then from there back to community hospitals. Then I had the privilege of running the Providence Health System up in Los Angeles for a lot of years. So I've spent most of my life institutionalized in organizations and hospitals. You know, I'm very comfortable in a hospital. And I spent a lot of time between the ED and the ICU in different places. But in all of that, I know how much we need health care. As I get older, I have healthcare needs, so I have what's called benign essential tremor, which is just that irritating little shaky shake, I call it. I don't have to stir my martinis, I can shake them. It's really, really easy. I've had 2 hip replacements. Then I decided to take a fall a few months ago, so I blew out the shoulder, so I did shoulder surgery. But in all those instances, every single time, guess who ends up coming to the rescue? Nurse. I've spent my life working with nurses, and I've always found, especially for those of you that are students, somebody inspired you. Something happened up here in my staff. I gave a little talk at Cal State Fullerton about the head and the heart, and they said, tell that story again. So somewhere along the way, somebody inspired you, and your brain grabs it and says, I like this knowledge, I like this information, I like medicine. Not everybody gets that. And then what happens in nursing is it moves from the head into the heart. And now you have a feeling about it. It's like, I want to do this, I want to help people, I want to reach out, I want to be a part of that clinical process, and I want to be part of healing. And I may not cure them, but I can add to healing and the goodness and the kindness of it all. Now, it has to work for the wallet as well, and that's part of the grant. You've got to make money doing this. You've got to be able to pay your bills. You've got to be able to pay the nursing program tuitions and all that. But between the head and the heart is where your nursing career will coalesce. If you look at our little wheel logo here, it's on the front and around, each of those discs is designed a little differently and with a different color. And it's intended to look at the diversity of our members that we provide insurance for. We insure 935,000 people in Orange County. So we're about a third of the county, and that means a third of the county lives below low income or the federal poverty level. And that includes students. CalFresh is a program that provides food. A lot of students are on that program. And we're part of that healthcare, and each of those discs is meant to represent, because each one of them is shaped a little differently. and the diversity in the culture. We have at least 28 different languages, 7 primary languages. Here in Irvine, we have about 55,000 of our members. You wouldn't think in the city of Irvine, that's about 37% of the population is low income. And they have a lot of healthcare needs. And we are so fortunate to have such great partners with our hospitals and caregivers and clinics, but all of them are staffed with nurses. We need you. We need you to take what started in your head and moved into your heart and take that love and compassion and bring that back out into the community to take care of folks. The other thing I would tell you is this: choose the nursing that fits you. Find the passion that fits you. I used to do an orientation for nurses that were going to work in a subacute unit. So a subacute unit is basically a very high-end skilled nursing facility, and they take care of vent and trach patients. Nobody wants to be on a tracheotomy. Nobody wants to be on a ventilator. Nobody wants to be on a T-bar. So nobody wants to be suctioned. Nobody wants to have an HME filter. Nobody wants any of that. Nobody wants to be stuck in bed. But whoever takes care of them, it's not about the nursing. It's not about the medical care. It's always about the love. You know it up here, but it's got to come from here. And your patients will feel that. They'll know if you really like taking care of them. They can tell if you're having a good day or a bad day just by how you move in the room, how you move the sheet, how you pick up the syringe, how you put stuff back in the little basket that's crammed with all sorts of stuff in hospital rooms. How you act will reflect what's in here. What you do happens up here. But if you marry these two together and you walk in with that attitude of compassion and love, you will be a great nurse. And that's why we want to put these grant dollars out. Supervisor Foley is your absolute champion. I mean, get her a banner, get her pom-poms, get her a float, and give her a trumpet and let her go. She is your champion. And we are thrilled to do this. We get the privilege of being able to take any public dollars that are left at the end of the budget year and redisperse them back out into the community. None of our dollars leave Orange County. None of our dollars leave Orange County. And so we're happy to bring them here. Use them well. Become a loving, compassionate nurse. Take this and this, marry it into what I call a vocation of nursing, and it really becomes part of you. So congratulations to the university. Thank you to your teachers. Thank you to the professors and deans and all the executives. Anne Marie and I have known each other for more years than I can count. Just bumped into each other today. Healthcare's small. And as I get older, if you find me in your hospital bed, in your room, would you remember, oh yeah, that was that guy? And be really nice. So thank you. Thank you, and I want to congratulate all of you. And now I'll introduce our Chief Operating Officer and someone that I respect beyond all measure, Yun Young Kim, also known as YK. And it's taken me a long time to get that first name down, that Yun Young. It's spelled Y-U-N-K, so you want to say Young. And then it's Y-U-N-G, Young, so Young, but it's not. It's Yoon like soon. So it's Yun Young, and I have trained myself to say this correctly. But she goes as YK, so it's much easier. And now we'll bring it all the way down here for YK.
Thank you, Michael. Thank you for prepping the mic for us folks who are a little lower to the ground. But that'll come in handy for Sana as well, who will speak after me. So as Michael said, I'm Yoon Kyung Kim, Chief Operating Officer for CalOptima Health, and it's a real pleasure and honor for me to join this really illustrious crowd today, and with all the nursing students and the faculty from UC Irvine. I look over there and I see our future providers and I see our future leaders, and I can't wait for you to graduate and come work in our industry and in our field, and hopefully some of you at CalOptima Health as well. So we look forward to welcoming you. I wanted to just provide a little bit of context as to CalOptima Health and our role and our goals with this partnership. As Michael mentioned, CalOptima Health, we're a health insurance plan. We serve nearly 1 in 3 of Orange County's residents with the Medi-Cal program and with the Medicare program. As we often think about at CalOptima Health, being that we are a third of the county, when CalOptima Health members are healthy, Orange County is healthier. We can all be healthy together. We also recognize that there is a growing need for and a growing disparity in providers needed to take care of this population of all of us and our families together. This $5 million grant for UC Irvine is part of CalOptima Health's Provider Workforce Development Initiative. And that initiative really aims to address health disparities and to secure the future of our health and medical delivery system for all of us, for our county, again, for all of our family members. Our board of directors, and actually one of our directors, Dr. Jose Mayorga, has joined us this morning, made a commitment to set aside $50 million from our reserves to really support this workforce initiative over the next 5 years. Across the county. And the program and partnership that we are launching here with UC Irvine is one of 7 that we are doing throughout the county. You all know there is a workforce shortage in healthcare all over the place. And so we are trying to do our part in partnering with you to, again, address those gaps, create a future for our county together. We know that UC Irvine and CalOptima Health's missions and vision and goals are aligned. We are privileged to serve some of you, some of the students as our members, and some of our students' families as members. And so as we start on this partnership together, we hope that this is a long-lasting impact, not only to the individual nursing students, but also to your families, to my family, to all of our families, and our community together. So thank you so much. And with that, it's my great pleasure to introduce one of your own UCI nursing student, Sana Mutalib.
Hello, everyone. Good morning. As a pre-licensure nursing student preparing to enter the workforce in 1 year, I'm honored to speak about the CalOptima Health Grant. This grant, as Dr. Lazenby mentioned, is designed to address the critical nursing workforce shortage and expand access to OC's most vulnerable populations. This grant holds immense potential for my personal journey and my cohorts, who's almost all practically here, and it will also enhance our community's well-being. The CalOptima grant facilitates invaluable professional connections and mentorship opportunities. Through this grant, there will be annual networking events, and the nurse OC community will all have the chance to learn from experienced healthcare professionals and build relationships that will support our career growth. These interactions are essential for staying informed about the latest healthcare practices, innovations, and ultimately improving the quality of care that we can all provide. Furthermore, by supporting my education and entry into the workforce, this grant directly contributes to addressing the critical nurse workforce shortage. More nurses in the fields means reduced workloads, better patient care, and improved healthcare outcomes for our community. Lastly, this grant is more than financial assistance. It's a vital investment in the future of healthcare. It empowers me to become a skilled and dedicated nurse, ready to tackle the challenges of the nursing shortage and enhance healthcare access for Orange County's most vulnerable populations. I'm deeply grateful for this opportunity and committed to making a positive impact in our community through my nursing career, and I know all of my colleagues are as well. So thank you so much.
Thank you, Sana. Now I'd like to invite all of our speakers up in front of the banner so we can get some photos for the check presentation.
Thank you, everyone, for coming. We invite you to the school to have a tour of our simulation center, which is on the first floor. You'll go out these doors, walk around, and you'll see staff, and you're welcome to, especially CalOptima health people, to come visit our simulation center. Thank you all for coming. Have a great day.